Good morning, good morning. Can you hear me? Can you let me know that you can hear me? Let's see. Can you guys let me know in the chat that you can hear me? My mic is not showing that it's working here. Good morning, everyone. Yes, thumbs up. Thumbs up means you can hear me. Ooh. Yes? Yes, you can hear me? Okay, so let's make sure you guys can hear me because I'm not getting any indications. Can you tell me where you guys are all coming from? And if I see that in the chats, then I will know you guys can hear me, okay? And then we can go on because I like to start on time. Um, oops, let's see. Okay, no one's putting in the chats where they're from, so I don't know if you guys can hear me or not. Can you give me a thumbs up? Can you let me know you guys are ready to go? Um, Okay, you guys can hear me. Yay. Okay. NJ, New Jersey. Oh, wow. Okay. So I at least have one person that's hearing. Okay. So for those of you who are new to my channel, um, my name is Christy, and I have been professionally treating skin uh, for over 17 years now. So this is actually my fourth career. Um, so if you can kind of do the math generally, you guys know that I am a senior citizen. So I've had lots of experience with skin. Okay, so today we're going to be talking about skin tightening treatments. And first of all, I want to say, because I noticed that when I looked it up just to kind of see how popular this topic was, I saw a lot of thumbnails that basically promised if you do these things or you use this product, your skin will tighten overnight. Okay, so first of all, we know that skin sagging is happens over time, right? So if that happens over time, obviously skin tightening is not going to happen overnight. So, um, first of all, if you guys have any questions with skin tightening, um, like certain products that you have questions on or methods to do skin tightening, go ahead and put it in the chats and I will go ahead and address that. Okay. So again, I like to know what audience that I'm speaking with. So if you can let me know if you guys are over 50, over 30, or 30 or under. And the reason why I picked that is because significant changes in the skin happen during those stages, generally speaking. So I don't want to address, for example, postmenopausal skin when I have an audience that is mostly under 30 or under 35, right? So if you guys can let me know what age group you guys are in, I can address that so it's more relevant to you. Okay. So just over 50, I'm dealing with a saggy neck. Okay. So 22 steps says she's just over 50, under the chin, down my neck. Okay. So yes, so the neck actually ages or is more visibly, the changes happen faster than your face. And typically, not always, but typically, that is because number one, um, you have less fat on your neck for most people. I know that when you're overweight, it may not be necessarily true, but if you're average weight. The other thing is that a lot of people forget to put sunscreen and skincare products on their neck. They just concentrate on their face. So let's talk about that. So, first of all, depending on how saggy the skin is on the neck, um, there is no cream, there's no firming neck cream, um, firming serum that is going to actually change the structure of the collagen and elastin on our skin to the point that, it's like really firm. So I hope you know that. I know that people who love skincare, they're always going to try the next thing. Oh, maybe this will work. Maybe that will work. And my clients who come and see me, I will always ask them, so how many products have you tried um, where it didn't work? Because obviously if it works, you're going to stick with it, right? So there's not any products that is going to change that. So here are several options that you can do when it's a firming neck. And I can't see your neck, so I don't know, right? So just know this: the more saggier the neck is, or the skin, the more invasive you have to go, right? Because the structure of the skin is the epidermis, the dermis. You have your subcutaneous fat underneath that. Then you have what's called, I have it written down here. I think it's fast. It's the muscular, it's a superficial muscular eponeurotic system, okay? And that is like your fascia. So if it's kind of saggy, yes, you can still fix it, believe it or not. Now, here's the thing with that. If you've heard of uh, radio frequency, you've heard of a lot of these heat things, these heat thermal energy treatments. And their claim is that when they put low level heat there, first of all, I don't really recommend that because that's where your thyroid is. Now, for those of you who don't know, I have autoimmune disease. I have hypothyroidism. You don't want to put any energy in that area as far as heat, right? And I've had clients where they've done it and they weren't seeing me, but they said that they swear that they have fat loss there. So the less fat you have there, the more, if you've ever seen someone who has the neck, and as we get older, they'll get like these it looks like lines of skin, where the neck is, they don't have as much fat here, so they get these like line things. I'm not sure if you guys are familiar with that. So the older we get, you don't want to be too skinny because the subcutaneous fat is what gives us a little bit more softness to our face. And so that gives the more appearance of youth, right? So let me see what you said. Under the chin, down my neck. I've always taken care of good at my face looks fine to include sunscreen every day. This is a result of weight loss, and I'm afraid the only fix is surgery. So if the skin is if it's actually the skin, and I again, because I cannot see your neck, if it's actually the skin, um, because of the sudden weight loss and it kind of hangs, then yes, you're going to have to look at surgery where they can go in and take that excess fat, or excuse me, excess skin and kind of tighten it, right? But if you know that it's like loose skin, but you can feel the fat underneath, then and it's kind of then you can actually use different methods. So with some of my clients, and if you look at the before and after pictures, I've actually included the before and after photos, link to that. You can actually see how she actually got more collagen in her skin, but she didn't do. Um, Hers wasn't really like the sag. I mean, she did have saggy skin, but it really plumped up with the microneedling that we did with the professional serum that we did. Um, Loose skin is where I feel the fat. Okay, so again, I cannot see your face, but I would look at that. I would look to see. But have you done anything as far as trying to treat your skin besides skincare products? So I mean, neck firming creams, they don't really work, right? So because the firming, okay, so here's, like I made that illustration, it's kind of like I did another YouTube video that came out just a few minutes before the live explaining why these skincare products don't work, right? So, um, and I know it's kind of like the weight industry where there's all these different companies that promise overnight success. If you just take this pill or do this, you're going to lose weight. Like I think it was Ozempic or something. You're going to lose weight and all this other stuff. That is not healthy for your body, right? So you're going to cause a lot of stress. You're actually going to cause a lot of inflammation in your body doing something that quickly. So if it took a long time to gain the weight over time, you can't expect overnight results. So it's the same thing with um, hyperpigmentation, fine lines and wrinkles. Fine lines and wrinkles are basically scars of the skin over time where it just repetitively creases back and forth, and eventually that collagen breaks down, right, and does that. But the cause of fine lines and wrinkles, believe it or not, is not necessarily the collagen, it's actually the elastin, because elastin is what makes the skin stretch. So if it doesn't stretch, right? Then it starts to scar because it's not stretching as much. So, um, most products, exercise I've seen, I have a dermal roller. Okay, so derma rollers are not really going to work. So what derma rollers do is it can stimulate microstimulation or marker circulation in that area. So it's not going to really It's not going to push products further into your skin. That actually has to be done with some kind of energy. This is why you use galvanic. This is why you use iontophoresis. It changes the chemical um, what do you call it? It uses electrical microcurrents to create a chemical reaction in and on your skin. Okay, so derma rollers, if anything, temporarily will bring blood to the area, which is good, and it will temporarily give the appearance of plumpness. But again, as soon as you don't do that within a few hours, it's just going to go back. So I think it's more of a, kind of to help with massage. And I'm not saying that there's no benefit of that because there is somewhat benefit. But if you're looking to actually, significantly firm up your neck, then you're going to have to use more. I don't want to say invasive, but more assertive methods. Um, it was a healthy diet and exercise. I meant, oh, microneedling. Oh, okay. So microneedling so basically with microneedling, that can help with that. However, so here is the thing with that. The serums that actually are on the market for significant change to stimulate collagen production, from what I know, right, you can only access that professionally. So there's some superficial improvements that you can do with your skin, but in order to see significant improvement, how the serums are different is they have um, they have DNA in there, and it's not human DNA, obviously, but it's basically they take that and that affects, so it stimulates the how do I make this like really simple? Basically, it punctures in to get into there, and it helps stimulate. So you have DNA, you have the mitochondria, you have lipids and proteins. So it basically stimulates the mitochondria. It increases the ATP, which is called adenosine triphosphate. So it's at a very, very molecular level. So as we age, the ATP in all of our cells, that's the energy resource, um, decreases. This is why as we get older, the time to heal our skin, the time for our skin to recover. When you work out and you're sore for days when you're older, it's because we have less ATP in all of our cells. So we get tired sooner and it takes longer to recover, whether it's your skin or your body. Okay. Um, so that's why it's a little bit more involved. Okay. Um, so I hope that helps. So what I would probably do is, um, yeah, if it's significantly sagging, 22 steps, I think is so cute. You're probably going to have to get more aggressive, but and it can be maintained because it seems like you're just over 50, so you can do it because I'm older than you, way older than you. So and you can do it. Okay. So it is possible. And then to maintain it as well. So I hope I answered your question. So Natasha, I got Botox in my neck and it helped the sag. So here's the thing with Botox, as you all know, familiar with is Botox is a neurotoxin, and basically it freezes the muscle, or it basically blocks the neurotransmitter from the muscle from moving. So what happens to oh, thanks. I appreciate that. So you guys, I have to tell you something. So you know how older people or younger people, they want to look older so that they can drink. So there's a local grocery store here, and the first Tuesday of the month they have a senior discount day for groceries. So it's not very much, but so I went in and I wanted to get my senior discount, and I got carded. So that was my little boost in ego, because I was like, "Wait, you're carding me to see if I'm old enough to get the discount?" And they're like, "Yeah, yeah." And so I thought it was hilarious. Anyway, so that was my little ego boost there. Um, anyway, so okay, so let's talk about Botox in the neck. I'm sure you've seen improvements with that, right? It's helping the sag. But what happens to muscle when you don't work the muscle over time? Can anyone tell me what happens to a muscle when it's not being worked? Anyone? I know there's a little bit of a delay in the what do you call in the chat there? Yes, Mojave. Yes. So atrophy. So when you have atrophy, right? Your the skin around that muscle actually looks saggier. So Natasha, I mean, more power to you. If that's what you're going to do, that's great. But there are other methods that actually help increase or stimulate the muscle, make your muscle stronger and fuller, just like biceps or whatever, so that it actually helps your skin. It firms up just because of the muscle underneath. So if you want to do that, it's simple for you, it's easier, great for you. But um, I'm more for the long term for me, and I've always treated my clients um, without medication, just because I have seen the side effects of doing medication, and the consequences of that usually are not worth it. So, but thanks for sharing, Natasha, because maybe that's something that 22 steps, you might want to consider. But please make sure that you exercises and microcurrent. Oh, okay. So those help. So here's the thing with the neck exercises and microcurrent with that. If you do Botox, so you have to wait until the Botox wears off, right? Because it's basically paralyzing the muscle. then you can do the thing. But it's and that will help. Um, However, you have to kind of look at it like somebody who goes to the gym and then really works out and then lets their muscle atrophy and then do it again, back and forth. But Natasha, whatever works for you, okay? Be careful with the microcurrent too, just because of the area of the thyroid, okay? Recommended Botox to help with my teeth grinding. I've been reluctant. What? So I bite down too. I have a really bad habit. When I was in grad school, it was during a very stressful time, and I actually bit down so hard that I cracked my tooth. So that the nerve was exposed and I was in so much pain. So I had to wear a night guard. Well, it was too late. I actually ended up getting a root canal because I was in so much pain. Years later, look, you guys. So if you guys noticed that in a couple videos back, I was like kind of chubby, it was because I had that root canal. I had an infection in that root canal and I had it removed. I did my research on those titanium implants that they say are inert. If you look at the research in the papers that are coming out with metals in your mouth, it's really dangerous. So look, I'm missing a tooth. Right there. I just got it done. So it's not worth it to me. You can't see it. It doesn't affect my speech. I'm not going to do any dental implants. So you have to do your research. And the dentist who did it, or the endodontist who did it, he told me the differences between the two. I went home and did my research. And then when I went in for my surgery, I said, I'm not doing the dental implant. And this is why. And I actually showed him the paper, the research on it. And he was like, oh, I wasn't aware of this. So with my autoimmune disease, I don't want anything affecting because it says that it can affect your thyroid and your brain. So I wasn't going to do that. Let's see. I got skin pen microneedling in a dermatology office, and now I have post-inflammatory hyperpigmentation. Oh, Lourdes. Okay, let's talk about that. So, anytime you increase inflammation, the reason why they're doing that is because the skin's response is to this stimulates the fibroblasts to help heal itself with collagen and elastin. However, I would like to ask you, Lourdes, what products that you were using with that, because there is a way to use microneedling without increasing post-inflammatory hyperpigmentation. It's kind of tricky, and this is where professionals understand what to do. And I also would like to know what your skin Fitzpatrick type is. So if you don't know what that is, I am a 3. So 3 is fair skin, but I can tan really well. 4, 5, and 6 are your browner or your darker skin types. The higher you go in your Fitzpatrick type, the darker you are, and the more prone you are to hyperpigmentation, and the harder it is to get rid of that, because that's what I specialize in. Okay, is hyperpigmentation. So I'd like to know about that. You would have carded me too, really? Okay, that's okay. I mean, I thought that person was kind of being snarky, like, I want to see your card to get your senior discount or whatever. So I was like, what? Anyway, Natasha, you're very, very welcome. Uh, let's see. I lived with autoimmune disorder as well, so we have to be careful. Yeah. So can you tell me what that is? So a doctor, a functional medicine doctor told me this. I'm not sure. I cannot verify the source, but he told me s- with all the women coming in, he probably generalizing is 7 out of 10 women have autoimmune disorder of some sort. And the 3 that don't, it's because they haven't been tested for it or it hasn't expressed itself yet. And this is why, because we have so many microplastics, we have PFOS, these are forever chemicals. So I spent a lot of time, too much time, I think, because it's all in the non-stick stuff too, as well. I got a toaster oven and all of them, Breville, all the nicer, they all coat the insides of it. Um, and I finally got Black& Decker because they haven't used that chemical inside their appliances since 2011 is what they said, and they use zinc on it. So that's what I did with that. On your channel for the neck. Okay, so one that's like, there's plenty of facial exercises out there, but please remember this. This is beneficial. Facial exercises can be beneficial, but remember this, that if you're doing it because you've got nasolabial folds or number 11 lines or frown lines, the muscles in, oh, here, let me see. This is what I show my clients. Let's see if where do I have I wasn't prepared for this, so I don't have where did I put that? I have a thing of a facial neck chart. I don't remember where I put it. And so the muscles, okay, so there's one muscle that goes this way. The muscles show our expression. The reason why we have these wrinkles over time is because of the expression, the facial expressions, they're called dynamic wrinkles, over and over again. We furrow our brows, we raise our eyebrows, we smile, right? So when you do these facial exercises, they're going to strengthen the muscle, but when you do them, it can deepen the creases because the creases came because you made that. So for example, when we have muscles here that go down to open our mouth, right? Right? So you can do those, but if you already have marionette lines that go down like that, it can exacerbate it. So what do you have to do? You have to use the counter muscle. If that makes any sense? Like it's like the push and pull of muscle, right? So you've got your biceps and you're pushing to strengthen the bicep. Pulling, you do the counter muscle in the back, right? So you have to do the muscle to help. There's a muscle that goes this way. I wish I had my chart. There's a muscle that goes this way that kind of pulls it back, if that makes any sense. So it'll definitely help because it will build that muscle up and kind of support your skin. But if you're trying to do it to, you know, get rid of the deep 11 lines, for example, you're not going to furrow your back brows. And then if you do this, your muscles lay in a way that it can only go certain ways. You're going to furrow these wrinkles, right? So you can do those, but you want to, you know, you want to use the other counteractive muscles as well. Because if you overwork the muscles in the face, it's just like if you overwork your biceps and you don't work your delts back here, you're going to end up being sunken because all this muscle is back here. You've got to have your back muscles to support this up here, if that makes any sense. Okay. So let's see. Okay, so with your neck, what I would recommend, one of the neck things is just basically you want to be able to, so your neck muscles only move this way, right? Up and down this way. So look at the muscles, since yours is up here, you want to focus here because the muscles here is going to pull this up. So, like bringing it out your jaw. So it helps stretch that out like this. Can you see it? I can't even see myself. So anything that's going to strengthen this muscle. Okay. Now, when you strengthen a muscle, you also have to stretch and relax that muscle, right? That's what you do when you're building muscle. You have to stretch it. Otherwise, you're going to have limited movement. So anything that's going to stretch out like this way, and this way. Okay. So, and then you also want to go back. So anything that's going to stretch out this way, if that makes any sense. Yeah, Black and Decker, I'm telling you. I'm going to do a video on this because I'm a researcher I am a total researcher. So this is why I don't hawk a bunch of products. Buy this, buy this, buy this, buy this, buy this, because I have a commitment to my this YouTube channel was not started to be a YouTube person. I'm a licensed professional. It was actually started initially for my clients. And how my channel grew was my clients would forward or share the video with other people. So it was total fluke. I was never expecting it to, grow. So um, it's to educate my clients, and I think this is why I have clients who've been with me for so long. Whenever they have a question about a product, they'll share videos of other dermatologists and plastic surgeons saying, "Well, what about this?" And then I would educate them on that. So that's how it was. Let's see. Yeah, that's an anecdotal statistic, right? So we don't know really, but the amount of if you look at how many of the women, so just one of my friends just recently told me she has lupus. So and then a couple of them got MS. These are all autoimmune related disorders. So um let's see. Well, I started up here when I was doing certain facial exercises and microcurrent movements. Yeah. So, for example, if you have marionette lines here and you're using microcurrent, you want to use. Oh, I wish I had my facial chart. Oh, here. I have them because I do so many consultations. Okay. So, this is good enough. Okay. See, do you see? Can you see this? See the muscle here? Whoops. I can't. Here? Ah, the ones that are going this way. You guys see that? That's gonna help pull so you don't have as much of the marionette lines. So you always want to use the muscle counter to that. I hope that makes sense. Okay. So, um, okay, good. You can see that. Okay, so Angelica, yes. So that's basically one of the things. Now, how many of you have heard, because I'm just talking to most of my clients. How many of you have heard that if you use radio frequency, if you use some kind of sonogram type sound waves to firm up wrinkles or firm up skin, that a lot of them are starting to, or they've noticed fat volume loss? Has anyone heard that? Or is it just clients? I have several clients who have gone to see plastic surgeons who've done these. Um, it's basically using thermal energy to do fine lines and wrinkles, and then they noticed that their face got all gaunt. Anyone, or is it just my clients who are saying that? Yes, radio frequency can also lose fat. hmm I've heard. Okay, good. Okay. Oh, um, okay. So I'm going to do another video that goes really in depth of that and why I don't use those. So, new face, let's talk about that. I don't have a new face, but if you see the new face, the two balls that are close together, okay, the energy transfer between the two is so close together. You have to have further width apart. So the best way to actually do microcurrent is what's called the pinch and hold method, right? Because you are able to get down into the muscle and um, that energy transfer is going between the two. So that length of that muscle there, right? Like, let's see if I can show. So you would put, yeah, okay, you'd put one there and one here. So that energy transfer is going back all that way. When you're using New Face, because it's impossible because the balls are like right next to each other, right? So there's a smaller area for the energy transfer. Does that make sense? Okay. So that's why. And New Face approached me, and if you notice, if you've been watching my channel a while, you'll notice I never promoted it. Um, so there's better and better machines. I'm gonna actually do a video on one that is pretty advanced now. So stay tuned for that. If you guys want me to do a live demo of this machine, uh, give me a thumbs up or put it in the comments that you want to see it. Okay. Because then I can actually show you in a live demo what to do. Okay. Um, and the face, they noticed it. So, okay. So when you say they, Mojave, are you talking about like your friends or just that you heard on YouTube? So, um, and plus with, yes, have heard. Really? Oh, wow. Okay, I need to go look at that. Okay. Um, oh, wow. Okay. So if you notice that, then I typically don't like to do heat because with that low level thermal energy, the reason why hyperpigmentation is more noticed with my clients during the summertime is because even, and I have clients go, I stayed indoors. I don't understand why my pigmentation got darker, even though, and I said, well, one is heat, right? So when the temperature rises, naturally our metabolism gets faster, your hair grows faster, your nails grow faster. And so does the melasma. So or your pigmentation. And because the sun is so close to the earth, even your walks to, the your car from the grocery store or you're just driving, that those short durations of UV exposure is going to stimulate more pigmentation. So there's nothing you can do about that. The way that you can actually minimize that is if you, first of all, if you use your vitamin C at night. I know that all these dermatologists and everyone says, and even I say to do vitamin C at night if you're using a anti-aging product that makes your skin photosensitive, that you would use that at night. But really, vitamin C, because it's highly oxidative, right? It breaks down very quickly when exposed to heat, light, and air. It doesn't make sense to put it on because as soon as you go outside, it really breaks down, right? It's not stable enough. So you have to pair that vitamin C with something that's going to actually keep it stable. This is why SkinCeuticals uses ferulic acid to stabilize that vitamin C. But also, so I talk in another video about astaxanthin. So astaxanthin is derived from microalgae, and they've done studies because that's the stuff that floats in the ocean, right? Where they actually put the light on it. They've exposed it to red, white, and blue light, and it actually increased in efficacy. They have to survive, right? That. And the flamingos turn pink when they eat the shrimp, right? Because of the pigments. That's what protects their skin from the sun. So I have my clients do certain protocols where they actually see significant improvements in their skin. And if you don't believe me, you can go to the link and look at some of my before and after pictures. Um, just heard on YouTube. Gosh, I guess a lot of influencers. So when you saying influencers, are you saying that people who have, I guess, tried the machine and then they found out that they're losing fat? Huh, let's see. Is there a microcurrent machine you can use at home? Julie, hi, welcome, Julie. Um, so microcurrent machine, yes, you can use it at home. Um, and a lot of the ones, and I know some people don't like this, but a lot of the ones that you see, not all of them, but the really inexpensive ones that you see that are from China, um, They're not FDA cleared, so we cannot verify because they may not have undergone testing of what actually the currents are, how steady the currents are, um, and if they're cheap, you may be doing more damage, right? So what I recommend, here are the two that I recommend. And if I have any professionals here, they're going to vouch for me as far as the professional one. Um, the first one is MyoLift. Now, MyoLift is the retail version. They have the actual one that's the mini pro version that I think you can get now, and that has the two utilizations of that. And if I would have known that, I would have had it here, but they have the two probes. So this way, when you have one, so let's pretend that I'm just going to use my pens here. Let's pretend that these are the two probes, right? So when you put the probe here, and then you put, here, let's do it on this side, here, right? And then you do here, and it's communicating, right, between the two, right? It has all that room to communicate, all that length of that muscle. Okay. So, but when you have like New Face or any other one, I don't want to pick on New Face, your communication is right here between the two pens. So that's why it's not quite as effective. The second one is biotherapeutics, BT Micro. I had one of their machines, not the new one that just came out, but I had one of their older ones for desquamation. I got it in 2012. I used it an average of 4 times a day, and then it finally went out in 2019. That's how long I used it. I mean, that's amazing. So I will do a video if you guys, if there's enough interest with this, so you guys can see how I do this and then how I help people that, get results. So, um, let's see here. So the one that you can use at home, so one is the one I told you. The one I'm gonna show you, it is recommended that you can get it done professionally, which is gonna cost a lot more, or under me, I usually teach my clients how to do it via video. Okay. And then they have access to products that the general public doesn't get, you know. So um Mojave, I'm so glad that this is great information for you. So they typically use, I don't know if you guys have seen, but they typically use radio frequency or a lot of the stuff that they use for the face. They also use for fat, like on your belly and your butt and your thighs. They've also done clinical studies with that where it actually reduces the adipose tissue. And the thing with that I, there's not enough information. So there's a term called senescence. Senescence means where your cells are, they're active, they're viable, right? But they're not dividing. So they're not dying off through apoptosis, right? Um, and so they're just taking up space. And that causes inflammation. So what happens with the overcrowding of the cells is they start to secrete a chemical that can cause inflammation in the body, in the cells. So that's a whole nother topic. But if you understand the functionality of the skin and how skincare can work together, and then what machines that you can use, you can really um, you can really help preserve your face, right? I tell my clients who they start to lose a lot of the collagen in their face, no collagen cream can work. You have to create your own collagen. So at my age, I should actually have way less facial fat, right? I don't use any fillers. If you look at how fillers disrupt the endocrine system, and when this first started coming out, I did my research and I said, I don't think this is going to dissolve. Now this was when I was, in my late 30s. I was like, I don't think this is going to dissolve. And I'm a late adapter. I wait until like research starts coming out. Um, and now I'm starting to see that it doesn't dissolve. So glad I didn't do that. But you can actually see this is all real. Okay. I don't put any fillers in my mouth or anything like that. You can maintain it with, now, this all depends on your diet as well. When you do this collagen, they use like, one canister of collagen and then they say it doesn't work. Okay, I've been doing this for years, 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 years. In the Japanese diet, they eat a lot of fish, as you know. Now, fish has collagen 1 and collagen 3. That is the majority of your skin's collagen. Now the collagen 2, there's actually many different strands of collagen, types of collagen, and your body will use it for your epithelial, like your capillaries, your organs, your joints. There's different types that go to different parts of the body, but your skin is majority of that is actually collagen 1 and collagen 3. So I do recommend that one particular collagen because that one is actually from its wild source. So that's the one that I use. So I've been doing it for years. So that is why the collagen has helped me. And the older I get, the more I can see the difference. Am I still taking the collagen? Yes, I put it in my smoothie. So that's how I do that. Okay. Senescent zombie cells not regenerating. Yes, exactly. They're zombie cells. Okay. So they don't regenerate. So they're alive. They're not dead, but they're taking up space. And that's what can cause the inflammation. So I hope that helps with that. Now, um, red light. If anybody wants to talk about red light or LED therapy. Okay, so here's one of the things that I'm seeing mistakes on YouTube, and I know they're going to regret it. Um, okay, how many do you guys want to know about like what products to use when, what products to use with certain machines and when not to use them? Or do you guys already know about all that? Can you guys let me know if you guys want to know about that? And what I mean by that is like anti-aging skincare products and things like that. You love your red light. Okay, so who wants to um, who wants to talk a little bit about that? Or do you not? Nobody in the audience uses LED lights or blue lights. Can you guys give me thumbs up? Can you guys let me know if that's something you guys want to talk about? Okay. Okay, so the younger generation has access to more anti-aging products than ever. And I'm seeing more and more mistakes. So what I think, actually, I'm already kind of seeing it. So the Gen X has been more, I think it's with social media, more obsessed with aging than ever before. I think they're more obsessed than my age group. I mean, of course that they're concerned, but I think Gen Xers are like over the top. So they think that if they use more actives and do more treatments, they will retain their youth. And actually, I think that I've seen several clients who are in that age category, and when I look at their pictures, I'm like, okay, they must be like in their early 40s, and they're not. So, um, okay, really quick. For acne facial extractions, my face got swollen and now it's drying off and it's dark. What? Okay, did you do an acid peel? I wanna know that. It's dark. What do you mean it's dark? Okay, you mean Gen Z. Yeah, what am I saying? Am I saying Gen X? Yeah. So, okay, Gela, is that right? I hope I said it right. Okay, I wanna know if you did a acne facial with an a peel. Okay, so, okay, so I know they're prematurely using anti-aging products. So here's the thing with that. When you are using, um, if you are using, because I don't know who's watching this, right? Radio frequency, microcurrent, any of these, microneedling, whatever, that is not the time to be using tretinoin. Okay. You If you ever hear someone saying you can use this in conjunction with that, not really, because you're causing at some level low level inflammation, whether it's from thermal, whether it's from sound, whether whatever. So it can increase the efficacy of the anti-aging product. And so logically you're thinking, well then I want to use both. No, because you can actually cause a reaction for your skin. Now, if you want to take a break from your red light and all the other stuff and then do your tretinoin, you can do that and then but you're going to have to wait depending on how long you've been using the tretinoin, a few weeks to a few months, letting that get out of your system, then go back to it. Okay. So you're going to have to do one or the other. You cannot do at the same time. Your skin will prematurely age when you do that. Okay. Even vitamin C, you have to be careful because you have to remember vitamin C is an acid, right? And it does reduce inflammation. So the time to use vitamin C is, for example, let's use Angelica because she did vitamin C or she's doing, sorry, she's doing the red light, right? So you'll do your red light first, okay? Wait a couple of days, then you can use your vitamin C, but not right away. Depending, I mean, if it's a really effective vitamin C, because some of my clients will do that, and then over time they build a sensitivity to vitamin C. And they're like, I used to never react with vitamin C. Now I have red, blotchy skin. And that's because you're using it too close to whatever method that you're using. Okay. So you have to be careful with that. Um, I'm trying to think of other now. Oh, so here's with the exception. So with hyaluronic acid, if you're just using a hyaluronic acid serum, meaning it doesn't have vitamin A in it, it doesn't have vitamin C in it, it doesn't have vitamin E. It's just hyaluronic acid. Okay. You can use that with microcurrent. You can do it after the light therapy. You can do it after radio frequency. You can do those afterwards. Now, if you put that on hyaluronic acid on dry skin, your skin is actually going to get more dehydrated because it's going to evaporate. Hyaluronic acid is basically salts, right? So you're going to have to put moisture on your skin first. Then the molecules of the hyaluronic acid, because it's a humectant, is going to draw to the moisture. Okay. Then put on some type of occlusive product that has occlusive agents to keep that moisture on your skin. Now, when you get to my age group, so anyone, let's just say, I don't know, like above 40, right? Especially 50 and then 60s, we lose hyaluronic acid in our skin, inside our skin. So the way you can help your skin, if you haven't watched that video, you can increase the production of hyaluronic acid in your skin and essential fatty acids in your skin by taking taurine. Okay, taurine. actually has been proven with that. You can look it up yourself, and that really helps. I've even done videos on the best time to take it, and so when when I see clients who are 50 and older, and I can tell they're lacking in their skin that, and no amount of product is, I mean, it'll temporarily relieve it, but I see in the comments all the time, I use it, but my skin is still really dry. That's typically why. Okay, let's see. The swollen area is darker. No peel. Okay. The swollen area is darker. So you probably have a little bit of post inflammatory hyperpigmentation. And do you have darker skin? That's what I want to know, if you have darker skin. Like, is the area, when you say darker, is it red or is it like a more darker reddish brown color? Okay. Uh, what about for older age and using? I'm 50. Okay, so I'm older than you when you say older age. So watch it there, happy Cappy. And use adapalene and no, 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 no. Okay, so are you using adapalene because of acne? Why are you using adapalene and red light? So what's going to happen is that red light is going to, I'm okay, you guys are going to have to catch this video. I've already done the video. I just have to get it edited. um you have to watch out. Okay, wait, you're saying I can't do red light on my face and do tretinoin red light in AM? Yes, because okay, the tretinoin stays, your skin is part of the integumentary system, so it's systemic. So tretinoin is photosensitive. It makes your skin photosensitive. What's red light? It's light photo. So you have to be careful with that. Don't do it together in conjunction, because you'll see over time you'll be like, my skin is quality looks different. Okay? So you're going to have to do one or the other as far as that goes. Okay? What else besides hyaluronic acid can I use at the same time as I'm using red light? So um, you want to use as less product as possible, believe it or not. You can use things that are anti-inflammatory. Actually, so what I would recommend, Angelica, and again, I can't see your face, but you want to use a lot of anti-inflammatory products after the red light. So not during the red light, but after red light. You want to reduce the inflammation as much as possible. Okay. Um, so I saw one video where they used salicylic acid peel with blue light. And blue light for darker skin actually increases hyperpigmentation. So now you're using a beta hydroxy acid, which makes your skin photosensitive, and then you use blue light, which has been shown pigmentation. So now you're going to get more pigmentation. This doesn't make any sense. Um, Yeah, so take taurine. Taurine's gonna help your skin at the cellular level. Your light skin and your darker. This is a problem. So when you say doing extractions, do you mean around the nose, your forehead, or your chin? And I ask that because, um, well, you'll see. So um, I just want to know, is it around your nose area or like areas where you've got more capillaries? I've been using it instead of tretinoin. Oh, I see. Okay. Um, yeah, you don't. So if you're going to use anything that's going to make your skin photosensitive and then you put light on there, think about it, guys. Okay. So I'm not saying to not use it. If you want to use it, you can use it, but you're basically putting on a product that makes your skin more photosensitive, and then you're using light. So you have to be careful. So you can do extensive period of red light, then you can use your tretinoin, adapalene, salicylic, whatever, right? And then wean off that, wait a little bit, then go ahead and use your red light. Okay? Yeah. Um, well, if you do 6 months tretinoin, you're going to have to probably do about 3 months of weaning from the tretinoin, and then you can use your red light. Okay? Um, Let me see. My cheek area where the extraction mostly took place is dark now and dry. Okay, so when you do extractions, if you guys ever have squeezed your skin and oil comes out, right? That's gonna typically you're gonna start to flake with your skin there. So that's normal. Um, but so my question to you, Gila, is did they recommend any products or are you using any products to help now reduce that inflammation and help keep moisture on the skin. So, because you can't go around being dark there, right? Because then you can get, if you have, you can get post-inflammatory hyperpigmentation from the extractions. Okay, it's just going to take some time. You are very, very welcome. Okay, so what are some other? I'm trying to think of some other actives that you can do with red light. Okay, so when you do certain types of light, it can temporarily shrink the sebaceous glands, just temporarily. They'll go back, right? So during that time that you're doing the red light, you're going to afterwards use things that are anti inflammatory and things that um, increase the hydration levels of your skin. Because remember, I always talk about one of the main things that can prematurely age your skin over time is prolonged dehydration of the skin. So when you have prolonged dehydration of the skin, that you have to remember your skin cells are they're not filled with water and most of your cells are made up of water, so they can't metabolize the nutrients and get rid of waste in their cells, right? If it's not hydrated. So that's why you can have prolonged dehydration. um, you start to have inflammation with that. Okay, so they use Gave products? What's Gave? Like collagen and vitamin C and oh, they gave you products, right? They gave you oh, it's not thought it was not normal. Yeah, if they went, especially if your skin is thinner and more sensitive than extractions can, it'll be like that for few days. Collagen, vitamin C, and face wash. Um, okay, so again, I can't see your face, but what I would recommend. Okay, so like the collagen thing, is it a collagen cream or a collagen serum? Collagen is not going to help superficially. The molecules are too big to bypass the stratum corneum. You're going to have to make the collagen yourself. And the way that you do that is you stimulate your fibroblasts. That's why you see all of these anti aging products that have um, things that kind of incite low level inflammation, whether it's the heat, microneedling, acid peels, all these anti-aging products are to stimulate stimulate collagen and elastin. It's to help heal the skin. The problem is if you don't mitigate that inflammation, then it can go backwards where your skin starts to prematurely age because you've done self-inflicted inflammation over time, over and over. The younger you are that you start, the shorter time periods in between that you do these inflammatory treatments, the more that you're going to start to see that these young people, as time goes by, they're going to start, and the ATP levels in our cells starts to decrease, and it won't be able to recover as quickly. That's when you're really going to start to see that. Um, it's a serum. It's a collagen serum. So, before I go off on the collagen serum, I want to see what maybe it says collagen serum, but it's to um, stimulate collagen production in your skin. I'm not sure because I don't know what it is. Can you write down what the product is? And maybe we can like look at that and see. So, And the face wash, if you hopefully that face wash is not cream based, okay? So, okay, so maybe we can take a look at that. Okay, so any other questions on it's cream based? Do you wait, it's cream based and you have acne. Is that right? You have breakout prone skin? I would want to okay, so it should be gel based. When you do the extractions, you sometimes people say I break out even more, sometimes a couple days afterwards. So your I'd have to look at the product and see if it's if it is. But I would recommend more of a gel based cleanser that you can like like a one that you can kind of see through kind of a thing. But when you say cream based, like for example, Dermalogica's the soothing one, ultra calming cleanser, even though it seems cream based, it's not cream based. That one is okay. But if it's really cream based, you may see an increase of breakouts or bumps in in your skin. I'm not saying it will, but again, without knowing what the product is, I'm not sure. Okay? Okay. Okay, so we are going on just over 1 hour. If nobody has any other questions, let me check to see what the other thing too is a lot of these, even though our skin is lipid based, um, it's got a lipid barrier on our skin. When you're doing a lot of these products, depending on the light, your skin type, and the product, and all of that, but generally speaking, I am speaking in really broad terms. What is going to work better for your skin, like serums and things like that, are going to be water based, right? Um, You want to stay away from facial oils until after you've done the treatment. You never want to use oils in conjunction. I saw this one young influencer that my one of my clients sent to me, um, where the poor girl was she put on oil on her face and then she did the microcurrent. You never want to use cream or oils with that. You always want to use water base. Okay. So this is why it's really potentially dangerous when you are listening to all these influencers. Yes, I can see, they're entertaining to watch. They can be really funny, all of that. When it comes to, buying things and trying things the way that they're doing it, like one person, I couldn't watch because I don't have TikTok, but they said that some people were using household products for skincare. I find that really hard to believe, but she said, "No, I'm telling you, they do that." And then you've got all these young people following. This is where it could be potentially really dangerous. So you need to um, get your information from people that really understand skin. Even some of these doctors that have recommended skin products, their specialty is not in skin. So, you know, some of the information that they're giving is not quite accurate. So you got to be careful. Okay. Let me scroll down. For other photosensitizing serums like vitamin C or HAs, could those be used a few days apart from? Yes. So you can use them, but you have to remember that, and this is, we want instant things, right? And so people don't want to wait. But when you use these things, depending on how long that you've used them, the longer you've used a product, the longer it takes to get it out of the system, out of your skin. So that's why when people use like retinol or tretinoin or glycolic acid or acne control products, and then they go in for an eyebrow wax, they think the person that did the eyebrow wax, like, um, you know, ruined their skin. Not necessarily. It that's why in an intake form, I always used to ask what they were using on their face, because you always have to wait a little bit because it thins the skin, right? So you always have to wait to let it get out of your system. So, for example, this person that is saying, so vitamin C is not a photosensitizing serum, just to clarify, Mojave. Okay. But salicylic acid is. So the best thing to do, like for example, let's say you're using the red light. What I would do is do the red light, right? Then you can use your vitamin C maybe like a day or two afterwards. Use that vitamin C. Then you're going to have to wait a couple more days before you do the red light, if that makes any sense. You don't want to do like, let's say you're using acne products and you go, oh, I have a pimple. So you put acne control products on it. And then the next day you do red light. That's going to actually make that, or wherever you put that, more photosensitive. And you'll actually see that it actually can get redder, right? It actually gets darker. So you always have to have a couple spaces or days in between, okay, to do that. Um, Apart from red light for women in their late 40s, 30s, and 40s. Yes, if that from red light. Yeah. I'm paying a lot of money using Obagi. Oh, summer and Tret products from Melasma. Is there a better way? Okay, Summer. So let's talk about that. So Obagi used to be owned by Dr. Obagi, and then he sold the company. If you look at the ingredients, they significantly changed. And some of them now, it's part of a publicly traded company. If you guys know how this works, publicly traded companies are um, they are accountable to their investors, and so they have quarterly reports where they have, it's all about profit. So anytime a small little company goes public, many times you will see them cheapen their products, right? Increase their marketing budget to market the heck out of it, right? So that people will buy it. And Obagi, what I don't like about Obagi is they've really increased their active products to the point that inflammation is so strong, that that inflammation causes more hyperpigmentation. They, now I don't know if they took it out, but a lot of their products had a lot of parabens in it. So they may have taken it out because a lot of people know now that parabens aren't necessarily, especially when you're using things that have ingredients to drive that active ingredient into the skin. So when you do that to increase penetration, well, so was the parabens going inside. Okay, so um, excuse me, and then you're using tretinoin for melasma. So Summer, given your little thumbnail, looks like you're a darker skin. That is the exact opposite of what you should be using. And if you do this long enough, what will happen, or it can happen, is that your skin may respond where it's getting lighter and lighter and lighter, and then all of a sudden it gets darker and darker and darker, and then no matter what you use, it becomes, this is called treatment resistant melasma, right? So the first thing when a client comes to me, they're using Obagi and they say that their skin is getting darker and darker and darker. First thing I do is we have to do kind of what I call loosely a detox. We got to get it out of the system. I have them using a lot of anti-inflammatories to get it out of their system. And many times, when we just do that, their skin gets lighter because we've stopped the inflammation. So, yeah, and Obashi is really expensive. I'm actually floored now at how much it is. So, Summer, I, without seeing your skin, I can see that you're a little bit, you're not fair in this picture. I probably would recommend that you, um, and I don't know if you're doing it just on your own or you're doing it with a dermatologist, but that's what I specialize in. You can look at my before and after pictures of how dark some of my clients were, one of them actually was using muesli, got really dark. And then you can see how her skin improved over time. So if you're under the treatment of somebody who is using a lot of that obagi, I probably would recommend that you stop. Is there a specific type of collagen that works best, not by brands, but by type of collagen? So, Julie, I know you came late to the party, but we talked about that. So, your skin is mostly made up of collagen 1 and collagen 3. There's many different types of collagen, and your body uses different types of collagen for your cartilage, for your joints, for your organs, that type of thing. But your skin, as far as what we're talking about, your skin, it's collagen 1 and collagen 3. And I always recommend marine collagen because marine collagen is collagen 1, collagen 3. It's easily more absorbed into the body. And I was sharing with people that I've been using it, excuse me, for years and years, way before collagen was a thing. Um, and I truly believe that is why I've got so much collagen at an age where um, most women my age lose significantly, especially after postmenopausal. Like, if you look at go back to my videos, I had really chubby cheeks. I was still taking collagen then, but then after postmenopause, you can see that I slimmed down significantly with that. But I still have a good amount. Um, Yes. Okay. Thank you. So, oh, you're Native American. Okay. So, if you're Native American, you're probably going to be a Fitzpatrick 4 or 5. I don't think you're going to be 6, but 4 or 5, right? So, so Summer, you can. I put the links in the description below the video where you can find out more information for your skin, particularly. You're going to look at the melasma treatment. Okay. And if you do the melasma quiz on my website, but it already kind of sounds like you may be treatment resistant, I would probably do that. And then it I think it gives you a special offer with the melasma treatment if you take the melasma quiz and it shows that you are treatment resistant. And the unique thing about my melasma quiz is it is intuitive. It's not one of these skin quizzes that, mostly A's goes to this, mostly B's goes to this. It's actually quite intuitive based on your answer, if you're going to be treatment resistant, and it recommends the melasma consultation because some of the levels, depending on what you choose, may not show the melasma quiz that you can actually solve your post-inflammatory hyperpigmentation or something like that with just products. Okay. um, okay, so yeah, and Julie, if you find that video, I do talk about the collagen powder. The one that I take is is with wild caught fish. And because the reason why I do that is because if you guys know anything about farmed fish, you wouldn't eat farmed fish, and you wouldn't take anything from the collagen as well, right? So um so that's another thing. Um I Compromise what by type of collagen. Yeah, so collagen 1 and collagen 3 is best. Now, here's the thing I'm going to tell you guys. Just by taking one canister of collagen and you're like, I don't see any difference, I'm going to stop taking it. Okay, you need to take this for years in order to see a difference. Now, if you are pre-menopausal or post-menopausal, I'm going to tell you that the collagen that you take, you have to, when you take this, it's to maintain and maybe improve incrementally. If you are under the age of, um, I'm going to say like mid to late 30s, you you're going to be able to um, really see a difference. In your 40s, you, depending on your diet, you won't have as much loss when you do get to postmenopausal. And I say postmenopausal because after menopause, your estrogen level takes a nosedive. And the first 5 years of menopause, you can lose, I don't know, it's like 33 to 37% of your collagen just within the 5 years. So it is significant. So it's a lifestyle. It's kind of like saying, well, if I lose this weight, how long can I stay thin without exercising? Well, that depends on your diet. You're going to have to keep having a healthy diet and lifestyle, right? Um, if you brush your teeth, how long can my teeth stay clean without me brushing my teeth? I mean, this is a lifestyle thing, right? So, um, so that's the thing. You also want to eat things that will help your hormone levels because that's what determines your collagen um, preservation as well, right? So if you're taking all this collagen, but you're eating poor foods and you know, we're already we're already just bombarded with endocrine disruptors, that's not going to help. So it's just one piece of the puzzle. If you can take things that help preserve collagen at a cellular level, okay? So I hope that helped, Julie, with the collagen tips. Also, here's another thing. When you are looking, like I do, when you are looking at someone and evaluating their face, yay, I'm so glad, Julie. Okay, when you're looking at their face, right, then you want to look at their neck or your neck, right? Not looking at other people's neck. I do it because it's my job, right? But and then the skin, like the chest. So the areas that show signs of aging is your face, your neck, your chest, your hands, right? So the way that you can tell if someone truly is less than their what do you call their biological age. I'm going to talk about in another video the difference between extrinsic aging and intrinsic aging and how you can evaluate that. So if you've ever seen women, more mature women, where their skin looks really good, right? But there's um, there's little data points that tell you that they're still older. The way that they move, their hair, um, their neck. So if you ever seen a woman that has really nice skin, but they're older, but their neck is really aged, right? So that's how I take it into evaluation as far as evaluating their how to do their skincare protocol, bringing in nutrition and things like that. So when someone is talking, or you're watching a YouTube video and they're talking about anti-aging, you want to take all of that into consideration because aging does not just happen on the face. It's just we pay attention to the face more, right? Because that's what we're looking at. But you want to look at the whole holistic. That's why I'm more focused on holistic. So my videos are more focused on both nutrition, even how you cook your food can introduce a lot of inflammation, right? Introducing a lot of reactive oxygen species into your body, and then at the cellular level, um, ages your skin. Okay. So I talk more about, I talk more about that. Okay. So any more questions as far as the skin firming or aging or what to use with your skin? I kind of had an outline here. Let's see. Oh, here's one other thing. So you know how they have those lights with the face mask? Um, I forgot what the names of those are. You know, the ones that you plug in and then it's like sitting right on your face. I probably would recommend one like the professional ones where and I'm sure that they have them, where it's not sitting like right on your face. A little bit above is good. You want a little bit of space in between. You don't want it that close to your skin. Okay. I can without derma roller, Dr. Gun, no one can guess my age. The derma roller has worked wonders on my hair. I am an active grandmother. Work those muscles, ladies, and smile often. Okay. Um, no questions, just that you're amazing. I'll say. um, Serums are a good temporary fix and do more damage than good in the long term. Okay, so vitamin E serums, lease, is that how you say it? That's oil based, right? So yes, vitamin E is really good. It's oil based, but for example, with vitamin C is water soluble. Now there are vitamin C derivatives that are lipid soluble. They take longer to work, but they are less sensitizing, and they tend to work better with people whose um, it's escaping me now, whose lipid barrier is compromised, right? It just depends on the person. If it's just vitamin E actually helps boost up vitamin C and vitamin A. Vitamin E is really good for your skin as far as moisturizing goes and has some antioxidant benefits, but it depends on who you're talking to. So, for example, someone who has really bad acne, you're not going to have them put vitamin E on their skin. They are not lipid poor. We're just trying to control the water, the lipid barrier, and the water barrier of their skin. If you throw that balance off, whether it's um, too much dehydration, their skin will produce too much oil. The last thing they need on their skin is vitamin E oil. So it just depends on who you are speaking with. So when you're speaking to an audience like this, that's generally speaking, you can't just say use this and you'll be fine. That is not true. I've done over 26,000 different treatments, and I can vouch that one thing that may be beneficial may not be beneficial for one specific person. Okay? Um, and when you say do more damage than good in the long term, um, Lise, I'm going to have to disagree with you on that, just because if they were not beneficial at all, then none of us would recommend serums. Water-based serums can be used as a conductivity gel as well, for when you're using it in conjunction with different products like derma rolling or um, microcurrent, or something like that. So it just depends. Iron Man masks. Oh my gosh, that's a great name. Yeah. So I prefer, just for safety, something that's, the ones that are kind of like the light and it's like a umbrella almost. So you're laying down and then it kind of covers your face. Those are, I think, much better. Um, Better to use the lamp. Yeah, travel lamps aren't really travel friendly. Um, yeah, anything that sits that close to your face, because we all have electrical energy, right? So I would prefer, like, if you look at a lot of the professional ones, they're not masks. They are those like lamp type things. I don't know how to describe it, but yeah. Um Over moisturizer at night. Okay, so emu oil is fine. I'd have to study the fatty acid, the lipid profile of that. Um, And so let's talk about, just really quick, about oils, right? Somebody would say, "Oh, um, coconut oil is the best," or uh, name an oil. This oil is the best, or whatever. So the oil, it's technically not an oil, but we call it jojoba oil. It is the most similar to the human sebum. So when you put it on there, it mimics the human sebum. And when your skin, this isn't really the right word, but like, metabolizes it, it kind of brings it on into its own, if that makes any sense. But that doesn't mean emu oil doesn't work or any of the other oils. So, like coconut oil, like I wouldn't recommend that for people who already are very lipid rich, right? Because they're not lacking those lipids. So, it just depends on the person and their diet too. Let me see here. Okay, what about infrared light in saunas? Um, so I haven't done enough information on that, but I'm just going to talk just on generally speaking. You are using heat. I guess it could kind of work, right? Because saunas, it's heat, right? So with heat, there's good and bad sides to that, right? Positive, and it helps loosen the muscles, but again, you're introducing that very level of inflammation. So, and then the red light has some anti-inflammatory. Um, I don't know if I would do both though at the same time. I probably, if it was me personally, I would do the sauna first, let my skin loosen, calm down. That redness goes away, that temperature of the skin goes down, the body temperature goes down. Then I would use the red light. That's just me personally, just knowing um, how the skin works. But here's the caveat: because I haven't done enough research on that, I can't really speak to that in detail. So um, I'm not going to talk too much about that just because I don't know. I haven't looked at the science behind that. Um, Now, oh, and I am talking about skin. This is probably more for healing as far as your soreness, um, your internal part. So again, I don't know enough too much about that. Um, Jojoba is the closest thing to skin. Yes, that's right. Okay, West Coast. Let's see. Wondering if the infrared sauna is bad for my face. Okay, if you have hyperpigmentation, I do not recommend saunas unless it's one of those you can. But how do you avoid your face, huh? Anything that's going to have heat is going to raise your body temperature, and you have hyperpigmentation. I do not recommend that. Um, I don't. So when I do a lot of these consultations, many times the people who have melasma, and part of it's the sun as well, but there are more people who have melasma in warmer parts of the country, right, than the colder parts of the country. So heat is part of it. Well, I'm sure you can do saunas. Just limit your time in the sauna. I would probably recommend that. What about cellulite on hips, arms, and belly? I'm 56 years old. Really healthy. No sugar. Half avocado every day. So, what do you mean? What about that? Um, you mean using saunas, or I'm not really sure what that means. I guess specifically fat. Okay, so this one, I guess specifically fat loss in the face. You mean as far as the sauna goes? I'm not really sure what that means. Fat loss in the face and then infrared light in the sauna? Is that what you're referring to? I don't know what that I'm not really sure what that means. Can you be more specific? 22 steps? I don't know what that means. What's the best red light therapy? I love these things of people want to know what's the best, red light therapy. So here's some critical thinking skill questions is What is the best red light therapy for me? What is the best skincare product for me? When you follow these different people and they're telling you about something, you have to remember your skin is going to be very different, chances are, than the person who's speaking. So when I do a general thing, I always say, this is recommended for this and this skin type. I don't recommend it for this and this skin type, and this is why. So the best red light therapy. So what are you trying to address? So that's the first question. So it just depends on what you're trying to address, what skincare products that you're using. So if you haven't been here from the very beginning, is it, oh boy, Chrissy? Chris, I'm so sorry if I mess it up. Um, I don't know if you caught it, but we talked about different anti-aging products that if you're planning to use in conjunction with different light therapies and how you would use them and when to avoid using certain ones when you are using red light therapy. Let's see. Yes, if the red light therapy in the sauna is not good for face and not wanting to lose fat in face getting older. Okay. Um, well, here is my thing about that. I'm sure it's okay, you know, um, fairly regularly, but not all the time because you have to remember now it may work differently. If you guys are telling me that people are experiencing fat loss because of thermal energy directed into their skin, if that is in case true, then I would hesitate on doing it a lot just because we don't know what the long term benefit in regards to facial fat. I'm not sure because I don't know if there's any studies that targeted specifically the effects of heat, like not directed at your face necessarily, but you're in a room where your whole body temperature rises, right? That it can affect the subcutaneous um, fat layer. So I'm not going to tell you not to do it. I think there are absolutely definitely benefits to that, but we don't know, right? If how that affects fat in your face. I know people do it to for weight loss. They go in the sauna for their bodies to lose weight. So I don't know if that will target your face, if that makes any sense. But if you are doing sauna for your body, yes, there's a lot of benefits for that. Um, Red light for tightening the skin and for texture of skin. For an older person, I'm 63 and skin color like yours, mix, not, oh, my little heart thing is in the way. Not oily, not dry, not allergic. So, Yanette, are you asking if red light for your, so finally somebody who is in, my age category here. Um, are you asking if red light is good for your skin, for tightening of the skin and texture of the skin? Or you're just stating that? Oh, yes. Okay, so you're asking that. Okay. Tightening of the skin, texture of the skin. Okay, so you can use red light for tightening of the skin, texture of the skin, but it also depends on what products that you are using. So let me give you an example, Yanette. If you are using, let's say, a facial exfoliator that has AHAs like glycolic acid or lactic acid, those make your skin photosensitive. Red light, whether it's red, white, blue light, UV light, they're all lights, right? It's going to make your skin photosensitive. So what this means is it's going to go deeper into your skin. Now, this all lights at some level will cause very low levels of inflammation to stimulate the fibroblasts. So, if you are, oh, you're welcome. If you are using red light, but you're also using products that also improve the texture of the skin, like the AHAs, you can cause further damage. So you don't want to do them in conjunction. Now, if you're saying all I use is a facial cleanser and moisturizer, that's all I use. I don't use any skincare actives, and you just want to do red light, that's fine. You don't have to pay attention to your skincare protocol. Okay. Um, Yes, glutathione is our best way to get glutathione, but I can't find a good product that doesn't include magnesium stearate. Any recommendation? Okay, the number one way for glutathione, obviously, is for your body to make it, right? But as we age, you don't make you make less and less glutathione. Now, there is a study. I did a video on how to increase your own glutathione. The study showed by up to 49%. This is a study that has been done over 25 years. And as we age, the good bacteria in our gut actually decreases as well. So it needs help. So there is one supplement that I recommended. It's actually a probiotic, given that assuming that your gut is healthy, because if your gut is not healthy and you do probiotics, right? Um, and you do probiotics, it can't it's very difficult to propagate that probiotic. So your gut needs to be healthy, especially if you have leaky gut, right? So you want to heal your gut first. But assuming that your gut is already healthy, if you take the Me-3, it's Lactobacillus fermentum Me-3. So there's many strains of Lactobacillus fermentum. If you use that particular strain, that has shown to help your body make its own glutathione and increase that. The most efficient way that they've shown is sublingual glutathione, where you put it under the tongue. Okay, so if you can get that, that can work. But really, the best nutrients or whatever, especially that's the only antioxidant our body makes, then I would support supplements that help you make the glutathione. You can also take liposomal glutathione. The glutathione levels in your blood do increase with that. However, probably the best way is with that Me-3, the Lactobacillus fermentum. And if you are interested in that, I can give you a link to that. Just let me know in the comments. Where was my place? Yeah, so and that does not include any magnesium stearate. It actually has support things to help, like L-methionine um, in it. So that's the best way. And you have to be careful with liposomal glutathione as well, because they will use a lot of times sunflower oil. Um, and I did recommend one if you want to use the liposomal glutathione where it has extra virgin olive oil. Obviously, because they're using a more expensive oil, it's going to be a little bit more expensive. This is how they cut costs, right? Because processed seed oil is very inexpensive. Um, so sublingual glutathione, typically you have to get through a doctor. They don't usually sell that. Now, this is in the United States. They don't usually sell that on the market. I've looked for it, but I can't find it. Um, so if you can usually get it from a doctor, the sublingual glutathione. Yeah. Okay, so we're going on, oh my, we are over an hour and a half. And I do have a lot of things I need to get done today. So I wanted to do this one just because based on messages I get, I just do it through that. Okay. I don't necessarily look for things that are trending. I just look at, what my clients are concerned with or dealing with. Okay. So Black seed oil helps boost. You know, I heard that too, but I don't see enough studies on that, so I'm not sure. I can't speak to that. I don't know. But I'd want to see more studies on that. And and Angelica, if you have those studies, please share it in the links. Okay. Okay, you guys have a great day, and I will talk to you soon. And if you guys have very specific concerns, you can email me. You can um, put it in the chat or on YouTube, and I can use that as a topic for our next live, or depending on what the question is, if it's really long and involved, I'll probably do that on a versus writing a whole thing for the chat. Okay. Castor oil is actually really good for the skin as well. Um, it Castor oil tends to work better. I mean, everybody can use it, but the people who need it the most are typically people who are lipid poor. And that's going to be your postmenopausal women that need that essential fatty acid, right? But if, again, if you want your skin to produce its own, so I used to use lots and lots of hand lotion because of what I did, right? I have to wash my hands before and after every client. What has helped me, I don't even use that much hand lotion anymore. I'm telling you, it just works. So when you increase your diet of essential fatty acids, but not only that, you do need the hyaluronic acid. So if you take taurine, use it for about 2 months, especially ladies that are lacking this, you are going to see a difference, okay, in your skin. I'm telling you. So do that. Um, Oils, if you don't do it the right way and you're using an oil that's not that is not similar to your skin, it can end up drying out your skin as well. And notice how I said drying out your skin, not dehydrating, because dehydrating skin is water poor, dry is lipid poor. Okay? Okay. So I'm going to have to get off here. I don't know if I can keep doing Saturdays because I usually have plans on Saturdays. So if you guys can put in the chat what times are best for you guys, I may consider that time as well. Because I do this because when I'm really busy during the week for consultation, then obviously, I can't do lives when I'm doing consultations. Okay, so I will talk to you guys soon. Okay, bye. Thanks for watching.